October is Breast Cancer Awareness Month, so we've brought in an expert to share tips that could save your life. Medical oncologist with Christus Shreveport-Bossier, Dr. Christopher Snead joins us now with more. Dr. Snead, thank you so much for joining the program. Let's jump right in here and talk about mammograms. Now, according to the National Breast Cancer Foundation, 1 in 8 women in the U.S. will be diagnosed with breast cancer in their life. So what age do you think women should start getting those mammograms?
Most people would agree that women around age 40 years of age should start getting mammograms, talking to their doctors about when to start screening. Some women may start getting mammograms sooner if they have a family history of breast cancer or have had some abnormal biopsies in the past that suggested that they may be at an increased risk of breast cancer in their lifetime.
And I know that this doesn't just affect women, right? It also affects men. Tell us about that.
That's correct. We do see male breast cancer most of the time in the news, and what we see in our practice is talking about women's breast cancer. Men's breast cancer is a lot of times treated similarly to women's breast cancer. It just occurs at a lot less frequent rate.
And when we hear about breast cancer, a lot of times we hear about family history or that someone may be predisposed to breast cancer. Can you dive into that a bit?
Yeah, so family history does play a role in determining one's possibility of getting breast cancer in their lifetime. Obviously, a family history of breast or ovarian cancer in first-degree relatives like mothers or other relatives such as aunts, and male breast cancer, people with ovarian cancer. Also, if people have had an atypical biopsy in the past, they could it's going to increase their risk of potentially developing breast cancer in their lifetime.
And if a woman is somehow hesitant to get a mammogram due to fear of pain, or maybe they just don't feel like it's a priority, what would your message be to them?
The earlier we can diagnose breast cancer, the better chance somebody's going to be a breast cancer survivor. We hear from family members and patients, well, it's just not convenient to go get my mammogram. But we have 2 locations, one in Bossier, one in Shreveport, that the Christus facilities here locally that are more than willing to accommodate people's busy schedule, get them in and out quickly. Some people say, well, it just didn't feel personable. It felt like I really didn't want to be there, or they're concerned about discomfort or embarrassment of getting the mammogram. It's a lot easier to get a yearly mammogram than it is to be diagnosed with an advanced breast cancer and be having to talk about real serious treatments like chemotherapy, radiation, and other things that nobody wants to go through.
And as you mentioned, that early detection is just so valuable. Dr. Snead, thank you so much for your insight.
Thank you.
All right, guys, keep it here. We'll be right back.
You're watching Fox 33 News first at 5:30 with Jezzamine Wolk.